Professor, thank you so much for being so patient. Quickly, I was just asking you to paint us a graphic picture of the situation in Kano State.
Right. I don't live in Kano, but the stories we're hearing are alarming. People are dying in Kano. I've lost two of my friends. They are professors at the university there. And daily we see the death toll increasing. And majority of them are above 50. So I tell everybody in this world now, any death of a patient above 50 years of age is COVID until proven otherwise. We cannot underplay that, and the reality is with us. What I've seen reported in some newspapers and television is strange illness caused the death of so many people in Kano. What illness can be more strange than COVID at this point in time? So more deaths in Kano than we've seen before. People try to attribute it to the lockdown, that chronically ill patients that have been locked down have not had access to healthcare, and that's why you see increasing mortality. But that's not acceptable, because there were lockdowns in Lagos and Port Harcourt before the lockdown in Kano. Why are we having a higher mortality in Kano? The whole idea is, I'm calling the attention of everybody, the policy makers, that we need to pay attention to Kano. Kano is a very densely populated place. We've not been testing. This is the honest truth. WHO says the key to control is testing, testing, testing. If you do not see any cases on any map, it's because you're not testing. That's the honest truth. Nigeria, we've tested only less than 10,000 with a population of 200 million. South Africa has tested 160,000. Even places like Djibouti, they have less than 1 million. We've tested about 8,000, 9,000. So let us not delude ourselves. The way to control is test, identify, isolate, treat if you need to, and then contact trace. If for a population of 200 million, where we have only tested 10,000, it's not who we get. We have a problem. And the problem is we are not testing.
Absolutely inadequate. And of course, even the task force, earlier we had a video of the Director General of the NCDC and the Health Minister. They're saying, you know what, our test is inadequate. And they are ramping up testing in the weeks to come. But quickly, just before the weekend, the lab in Kano, the DG of the NCDC had said they were going to open it. But now you've told us you don't even stay in Kano, so you might not give us the answers
no,
that
I
we
know.
require.
But
can you confirm if the lab has been reopened and testing has resumed in Kano State?
Right. So why was the lab closed? The lab was closed because laboratory staff were infected, because of poor protection for them. The Kano and the whole of the Northwest is being served by that lab. The lab has been closed, they say, until decontamination, and samples are taken to Abuja. Patients wait for 5, 6, 7 days. So it's not adequate. We need many labs and we need many tests. The capacity of NCDC now, they say for testing daily, I've had the DG say that, daily testing is 3,000. Give me 3,000, I go to Kano, I'll come out with 3,000 positives. The point I'm making, and this is an honest scientific point, we are under testing, we are not aggressive, we are behind the ball. We must test. The lab in Kano needs to open and serve millions of people in a place where there's a very high mortality. The highest mortality you have in this country is in Kano. We must have labs there, opening, like yesterday, not today or tomorrow.
Professor Yusuf, I want to draw your attention back to the second piece that you had written, and you suggested a forceful federal presence in Kano State. How do you think this can be achieved without breaking the Constitution? And what really do you think the federal government present in Kano can really do at this point for the people of the state?
Yes. I want people to realize we are at war with an unseen enemy. This is not like Boko Haram or bandits where you hear bombs going off. We don't see this enemy and people are dying. For us to control this disease, we have to have social distancing and absolute lockdown. That's the only way. What's currently happening in Kano is a joke. Kids are going to play soccer. There are weddings. People are gathering in religious places. People are coming out daily to eke a living. And this is the reality. They come out daily to eke a living. The virus does not go on break for them to come out. For us to control COVID-19 in Kano, we need to be honest with ourselves and take more drastic measures. So far, the government in Kano has shown it cannot do that. The federal government needs to step in because this is a national security imperative. If we continue to have mortality in Kano, this virus will spread all across the north, all across the country, all across the West Africa sub-region, and across Africa, destabilizing it. The federal government needs to step in, make sure lockdown is enforced. You cannot lock people at home without feeding them. So I'm asking for the federal government, the state government, and all people of means in Kano to please help people, give them food, give them things that will keep them at home for at least a month. People will have no reason to come out. And then you will have federal presence there to lock the city down. This is war. This is not a joke. The mortality of this disease is about 1%. We are talking 2 million Nigerians dying. We are already behind the ball. This is serious. I'm raising my voice. The federal government needs to come in, help people with food and palliative, work with traditional rulers, work with religious rulers, work with politicians, and educate people aggressively. People will stay home if they have things to eat, and lock the city down for a month and investigate and contact trace and test.
But you can't keep the people at home hungry. Professor Usman Yusuf, I'd have to say thank you so much for, helping us unpack all that has been happening with regards to Kano and, of course, COVID-19 generally. Thank you so much for joining us tonight.